Diagnosis and management of PCOS. How to diagnose PCOS, that is polycystic ovarian syndrome. Symptoms and clinical features. Symptoms and clinical features are most important in early diagnosis. Patient gives history of irregular menstruation, acne, excess facial hair growth, and weight gain. During reproductive age, women may have history of infertility. And laboratory tests. Blood tests to know the level of some hormones, blood sugar, insulin, insulin growth factor 1, cholesterol, and triglycerides level in PCOS women. Criteria for metabolic syndrome in PCOS women: abdominal obesity, that is waist circumference more than 88 cm or 35 inches. Triglycerides more than 150 mg per dl. HDL-C less than 50 mg per dl. Blood pressure more than 130/85. Fasting blood sugar of 110 to 126 mg per dl and 2-hour glucose from oral glucose tolerance test of 140 to 199 mg per dl. So all these were criteria for metabolic syndrome in PCOS women. If these are in any woman, if these laboratory tests, it means she is prone to PCOS, she is a patient of PCOS. Ultrasonography. Ultrasonographic examination is a useful method for early detection of PCOS and follow-up. Generally, ovarian size is increased. The most important ultrasonographic finding is a bilaterally increased number of microcysts measuring 0.5 to 0.8 cm with generally more than 5 microcysts in each ovary. Management. The management of PCOS depends upon clinical symptoms and presenting problems. Like, you have to do weight loss. In obese women, weight loss should be the first line of treatment. A reduction in body weight of 5 to 10% will cause a 30% reduction in visceral fat, which is often sufficient to restore ovulation and reduce markers of metabolic disease. Oral contraceptives. Often OCPs can have the benefits of contraception, protection against endometrial cancer, and improve skin manifestations such as acne and hirsutism. Acne. Mild acne can be treated topically with keratinol latex such as azelaic acids, retinoids, or with antibacterials erythromycin 2% gel or clindamycin 1% lotion. Severe forms can be treated by oral antibiotics or isotretinoin. But in PCOS, anti-androgens are most effective because acne occurs as a result of hyperstimulation of sebaceous glands by androgens. Cyproterone acetate, spironolactone, flutamide, and finasteride have anti-androgenic properties. Cyproterone acetate can be combined with OCPs. Hirsutism. Hirsutism can be treated by physical therapy such as bleaching, shaving, plucking, depilatory creams, or electrolysis and laser. Combined oral contraceptive is useful for prevention of excess hair growth. Alopecia. Psychological supports and hairstyling are the treatment for alopecia. Drugs such as minoxidil, cyproterone acetate, spironolactone has limited role. Infertility. Main cause of infertility in PCOS is anovulation. So methods of inducing ovulation are reduction of insulin concentrations, FSH, stimulation and reduction in LH concentration. Weight loss. Weight loss is the mainstay therapy for induction of ovulation. Weight loss improves endocrine profile and likelihood of ovulation and a healthy pregnancy. Diet plan and exercises should be encouraged. Clomiphene citrate. Clomiphene citrate 50 mg orally for 5 days is a common method to induce ovulation. Serial transvaginal ultrasound is used to look for follicles, or urinary LH test can also be done to know fertile period. Metformin. For treating hyperinsulinemia in PCOS women, metformin 500 mg 8 hourly is an effective treatment. In patients who do not ovulate with clomiphene citrate and metformin, doctor can advise for laparoscopic ovarian drilling or parenteral gonadotrophic therapy. Laparoscopic ovarian drilling. Laparoscopic ovarian drilling is a simple procedure whereby several punctures are made in one or both the polycystic ovaries. Gonadotropin therapy. Gonadotropin therapy is indicated for women with anovulatory PCOS who have been treated with antiestrogens, either if they have failed to ovulate or if they have a response to clomiphene that is likely to reduce their chance of conception. Patients are started with very low dose gonadotropin, FSH, and the dose is gradually increased. When the leading follicle reaches 14 mm, the FSH threshold dose is reduced by half. In some patients, in vitro fertilization or even intracytoplasmic sperm injection may be the only option for pregnancy. Complications. PCOS patients are increased risk of developing chronic diseases which are directly linked to obesity in PCOS. Non-insulin dependent diabetes mellitus, cardiovascular diseases such as hypertension and coronary heart disease, endometrial cancer, infertility, depression and anxiety. Because of the risk of chronic disorders, PCOS patients are advised to continue follow-up every 6 months. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.